So one of my interests is really in aortic valve stenosis. So I'm a cardiologist, I'm interested in all cardiovascular diseases, and I believe there's a role. I've studied the role of specialized pro-resolving mediators with a special interest in aortic valve stenosis, because aortic valve stenosis, it's common, and we should remember that there is no medical treatment as of today. The treatment is through catheter-based or surgical aortic valve replacement. And therefore, it's very important to look into the disease mechanisms that is driven by lipids, by calcification, and a role of inflammation. And this is where there's a potential role for the pro-resolving lipid mediators. And we've been interested in this and studied this through different angles. We looked on the omega-3 accumulation in stenotic aortic valves, in that there are lower levels of omega-3 fatty acid in calcified part of stenotic aortic valves compared with healthy parts. And we've also looked into models of disease progression. So the background of aortic valve stenosis is that the aortic valve, which is located between the left ventricle and the aorta, the valve does not open, meaning that there is an obstruction to the outflow. So when this becomes severe and is not treated, this will lead to heart failure and bad prognosis in aortic stenosis, symptomatic aortic stenosis. So that's why it's important to find a treatment. And in the role of inflammation, one could be one way, and if it is possible to induce a resolution of inflammation. So our studies have focused on the signaling of EPA metabolism into resolving E1, and the signaling of resolving E1 through the receptor CAMR23. And in models of aortic stenosis, we've shown that omega-3 fatty acid had a beneficial effect, but in the absence of the receptor to resolving E1, there were no beneficial effects in the model of aortic stenosis. So this raises a notion of the signaling of omega-3 metabolism into ligands for the CAMR23 receptor. So the findings in our research on SPMs is based on the receptors. So we have really gone through the different receptors for SPMs and how they are implicated in cardiovascular diseases. We looked at the receptor expression in human disease and also use different models and see how deletion of the receptor will affect the disease progression. Now, the next step in translation is, of course, to get this to benefit to the cardiology patients, and there is a need for further mechanistic insights into this, how this resolution of inflammation can be induced to treat cardiovascular diseases and to provide a dampening of the inflammation while not leading to immunosuppression and so to be able to induce a resolution of inflammation without inducing immunosuppression. So there's still a lot of work left to be done to really see the full potential of these mediators in inducing a beneficial immunomodulation. We did go further than not only looking into cardiovascular disease, but we have also conducted a trial of omega-3 treatment of COVID-19 in order to be able to see immunomodulation. And it was a small exploratory proof of concept trial which showed that there was a beneficial immunomodulation, and we could also detect precursors for the pro-resolving mediators in patients treated with omega-3 fatty acids as part of the treatment of COVID-19. So we performed a randomized single-blind trial of intravenous omega-3 treatment in patients who were hospitalized for COVID-19. This study was performed before vaccination, so in the first and second wave of COVID-19. And the aim of the trial was to explore the immune response, to look at immunomodulation. And we looked at the different immune cell reactions and could monitor immunomodulation. We could see an increased phagocytosis activity in immune cells and a decreased leukocyte platelet aggregates. And we also saw in these patients a decreased neutrophil to lymphocyte ratio as part of signs of a beneficial immunomodulation. What we should know, however, is that it was a small trial, proof of concept, and larger clinical trials are needed to establish the effects.